Miss Katie. My name is Robert. I am your nurse today. I'm just going to come in here and do a little quick postpartum assessment of you. We're going to check over everything, make sure everything's going good. Again, what's your name? Katie? Date of birth? November 11th. And do you have any allergies? No? Okay, great. So, put these gloves on quick. How you feeling? Any pain? Any issues? Okay, great. So, looks like you're 24 hours post-labor. So I am just going to start assessing some vital signs real quick. First, I'm going to listen to your heart. Move this down, listen to your heart. Great. Take some deep breaths. Okay, I am going to just lift this up and listen to some bowel sounds.
Oh yeah.
Okay, great. So have you had a bowel movement yet? No? Okay, well that's pretty normal. Sometimes it takes 2 to 3 days to have a bowel movement. Some of the opioids not moving around, things like that for pain. So we're gonna try to have one, like I said, in the next 2 to 3 days. If you don't have one by tomorrow, we can get you a stool softener and make things a little bit easier and go from there. Have you been urinating at all? Okay, great. So we want you to be urinating probably every 2 to 3 hours as often as you can. What happens is, if you don't urinate, your bladder gets full, pushes on your uterus, and then you can start bleeding again. So when you feel like urinating, don't hold it in. Let's just try to go hit the call light, come get us, we'll help you there. Okay, so what I'm gonna do now for assessment, the first thing is I'm gonna check your breast. I'm just gonna feel on the outside, see if your milk is coming in, okay? Look at this one. Any pain? No? Okay, so your breasts are soft and they're non-tender. Tomorrow we can start expecting them to be a little bit more firm and still not tender, and around day 3 is when your milk will fully come in, and it's gonna be firm and tender to the touch, and that's when you're gonna start really feeling engorged and want to be breastfeeding. That's when you'll start, like I said, getting some pain. Let us know. But right now, you have a little bit of, looks like redness on your nipples. How's breastfeeding been going? Okay, well, this is your first child? Okay, great. So next time you breastfeed, why don't you call us, let me know. We're gonna come and watch. Maybe I can give you some pointers, some advice, maybe get a little bit better latch. What we want is we want him to be kind of fully all the way around the nipple, not just on the little top portion. We can sit him upright more. You don't have to worry about him suffocating. And for right now, with a little bit of redness, it starts cracking, kind of express a little colostrum. That's kind of the pre-milk fluid that you have now that's packed with nutrients onto the nipples, and that will help kind of heal them a bit. Okay? Next, I'm gonna have to feel your uterus. I'm gonna just lift her down up, okay? And I'm gonna lower the head of the bed. That way we can get a little bit better feel. Put my hand here. I'm just gonna kind of push down, try to feel where your fundus is. Okay, it's firm. It's midline down the center. About 1 finger width below, which is normal for 24 hours after pregnancy. So what happens is your uterus is slowly every day going to get smaller and smaller and tighter, and that's tight and firmness is what keeps the bleeding from happening. So right now you're on track right there, being in the right position. Okay, again, I'm going to kind of pull this pad down. I'm going to have to check out your lower area, okay? I got about 2 inches of bleeding on your pad. There's nothing down on your chuck, so that's good. When's the last time you changed your pad? 2 hours ago? Okay, so that's great. It's bright red right now, 2 inches or so, and it means it's kind of a light to scant amount of blood. That's what we're gonna wanna see. And then about 3 days or so, 4 days, the redness is gonna turn to pink-brown, which will last about 2 weeks, and you'll start getting a white discharge after that. Now, if you get up to move around, to go to the bathroom or anything, you might notice a sudden bleeding that will soak your pad. It'll be bright red. That is normal. It is just moving around your uterus is kind of discharging a little bit extra that's there. The concern is if it keeps bleeding. Go through one pad, if it lasts for more than 30 minutes, give us a call. Have you had any hemorrhoids? Yes? Okay, well let me check those out. But first, again, I'm gonna pull this down. We're gonna look and see. You got a little bit of episiotomy, so they had a cut and they sutured it together. Looking for redness, edema, which is no edema, no redness, no ecchymosis, no discharge of pus, and your edges are still sutured together. That's great. Alright, so I cannot see the hemorrhoids right now, so I'm gonna have you roll to your side, okay? Alright. Your hemorrhoids are looking good. Do you have pain at all? Okay. So, if you have pain, we can give you a topical cream. That helps. We want to keep it dry. We want to keep it washed. So one thing to do is every time you wipe, you want to go from front to back, top to bottom. And we also want to use your peri-wash, that bottle we gave you, to spray there and let it drip again from the top to the back. That'll help keep things clean. All right, just let me get rid of my gloves. Hey, right now I'm just going to pull this back down. I'm going to look at your legs. I'm going to look for any clots, any redness. Do you have any pain in your legs? No pain? Okay, there's no redness, no pain, no warmth. You can feel your pedal pulses. Feeling good. Your cap refill's good. Great. So is this your first child? It is. Okay. How are you feeling with everything? It seems like you're happy, excited. Okay, great. Well, I just want to give you a little bit of information. It is common within the first 4 to 14 days to feel a rush of emotions. You can feel sad. We kind of call it the blues, the baby blues. That is normal. You can talk to your husband if you're concerned. Talk to your pediatrician or your GP. But what we want to know is if it goes past that stage, it lasts a month, you start feeling like you're going to hurt yourself, hurt the baby, things are becoming too much. Again, that's normal in over half the women, so feel free to definitely call us, have your husband call us, and we can figure out a plan from there. Okay, and a couple of things. Grandparents are going to be involved, and they're going to give you a lot of opinions, but things have changed in the last 30 years, so don't be afraid of saying no to them or checking with us. Call your pediatrician. I called mine probably 30 times with my first kids. You might as well start now instead of being worried about stuff. So again, call often, check on things. I looked at your charts. You are an O positive blood, and your baby is O positive also. So that means, as you may have heard the term ROGAM, that is just when mother's O negative or a negative blood, the baby's positive, and we have to give you an extra shot of ROGAM. You don't need that now or for future pregnancies, which is good. I also see that you're rubella immune. That is German measles. You probably got a vaccine when you were younger, the MMR vaccine. So you're good there. All right, do you have any other questions for me? No? Okay, great. Well, let me know if you have any things, and thank you.